3 months out. I actually didn't believe you could do all that under local anesthesia as well. I was a little scared. Just not, I think more anxiety, just not knowing what's going to happen, and you're going to lay there for that long. You're going to get, what do you do while you're laying there? You're being worked on for several hours. But it went by really fast. And then I know I was kind of dozing in and out, in and out. I remember, a few things. That was the time that I had it done was when Houston had the freeze. So I do remember walking out, and I think they had iced it because it was the night before we had the snow. And I was thinking it had already started snowing, at that time. But, I that you gave me a mirror like right after, and I looked at myself, and I already was like in awe, like loving what I saw, immediately after. Recovery was really, really good for everything that got done, that I had done. I guess the swelling lasted a little bit longer than I was thinking, but I think I was just not realistic, as realistic about it, because I wanted to get back to work as soon as possible. So I actually was back in the office like 1 week after, surgery, which was probably a little soon, but I felt fine. My face looked a little puffy, and to me, I felt like I looked a little bit like an alien or something. My face was a little bit squished in for another week or so. But no one looked at me like funny, like and then, just gradually started, getting better and better. It's like, every time I look in the mirror, like you said, I smile because I like what I see. I think, you pointed out to me my neck today, how sharp my jawline is. I don't think I've ever seen it that sharp. Like, I don't remember my whole life ever seeing it like that. Like, I keep feeling this going, wow, I've always had, that. And then, I like that my cheekbones are really, high. I feel like I have defined, cheekbones, and my facial features, I just feel like you can see a lot more of because I don't have like the extra sagging jawline and skin. And then I think you pointed out, I redid my hair, I got lashes, just trying to, make everything else kind of match to where I look and feel, a lot younger, like I did, 10, 15 years ago, or maybe earlier. My daughter, actually, who is 20, she was actually saying, we're going on a cruise, and she's like, can I pass for you? Maybe if you put your hair back, I can, use your card or whatever. So, just because we have a lot of the same features, facial features, but I don't want to pretend to pass for a 20-year-old, but I do think I look a lot younger, and a lot of people I have people that came back into the office that were working remote like 5 years. They came back in, and they were looking at me like, wow, because they said, you look really good, so I'm happy. I think I'm more confident in myself than I was before. Like before, I always hid from the camera and things like that. Like I did not want to be behind the lens, or in front of the lens, sorry. Now it's not like that. And then now I think, I guess, like you said, I smile more. I'm more self-confident. I feel like I want to be seen more. And before, you would have never caught me dead going out of the house without full face of makeup. Now I can walk out the door and I put sunscreen on and I could just go. So I feel so much better, because I feel like, and I think the chemical peel helped with that too, the texture of my skin and everything. But just the confidence that I have, I think that protrudes. And that's probably a lot of what the other person, was feeling as well. I don't know. But I know you do get noticed from other people. I just try to, I don't want to be noticed, but yes, it is nice to have someone say, "Oh my gosh, you look so pretty," or whatever. But it just, if you have a lot of people complimenting you, I think I don't know, makes me feel a little embarrassed, I guess. But yeah. My name is Cherica. I am 51 years old. We are doing a facelift, a neck lift, a brow lift, fat transfer, and a chemical pip. Local with oral sedation. So last night I think all weekend really, I was anxious, excited, just a little bit nervous, but not too bad. But more than anything, just excited. So after losing a lot of weight and then of course aging, noticed, just not looking as young as I felt inside, and then just noticed sagging and kind of drooping. So hoping to look in the mirror and just, love what I see again and, feel the way look the way I feel. From what all the videos and stuff that I've read on it, seems to be very, your recovery is a lot faster, reduces swelling and bruising. So excited about that. I think I saw one video where some lady drove like 2 hours away to come do it. So that says a lot to me.
I'm super pumped. Okay, I'm ready. So let's go get this show on the road. All right.
Let's do it.
I'm going to start marking you up and doing all that kind of stuff, and you can start taking your medications.
Okay.
All righty. How was it?
It was good.
Not bad at all?
No.
Did you ever think that you could get a facelift and walk out to your car?
No.
Pretty cool, right?
Yeah. Handle the basics.
So we have Cherica here. She's post-operative day number 1. So literally we finished surgery. What time did we finish yesterday? About 5 o'clock?
Yeah.
5 o'clock. It's about 9 o'clock in the morning the next day. So I've taken the dressings down. That's all I've done. She still has her drains in. How was the first day?
It was actually pretty good. A lot better than I thought it was going to be. No like severe pain or anything. It was just a little bit of tightness and a headache.
So what happens to a lot of my patients is I think they forget what surgery was like. So before you forget what it was like, how bad was it?
It wasn't bad at all. I was dozing in and out.
A lot. Dozing in and out of that.
But I remember several things. Like I could hear like some snipping or whatever, but that was about it.
Okay. So for everyone, we did local anesthesia, oral sedation. Okay. Mm-hmm. I did a full brow lift on her. Okay. Sometimes I just do a medial, sometimes do a lateral. I did both medial and lateral on her. Full face and neck lift. Fat transfer. We did some fat transfer to her hands. Mm-hmm. Then we did a chemical peel. Face and neck lift. Other than that, did I leave anything out?
No.
All under local anesthesia. And she walked out of here.
Yep.
Which is the cool thing. I say this a million times. We do this primarily because of the fact that we want our patients to heal quicker, faster. she walked here this morning. I mean, not walked from home, but, got out of the car, walked here. She's walking unassisted. So this is, if we had done general anesthesia, there would probably still be a little bit of that grogginess. And she is bright-eyed and bushy-tailed. So this is what I consider a victory. And what do you have to say? Anything that you'd like to add to my thoughts?
I love it. I love it. It's only one day, so I know it's going to get better from here. But so far, I love it. It made me look a lot younger, but still like myself.
You still look like you. Yeah. I think it really opened up your eyes.
Yeah, it did.
Yeah.
I really like the brow lift.
Yeah. And the neck looks amazing. Yeah. I think it really kicked it. All right. Cool beans. I'm going to see her back. Oh, how was, I'm sure everybody is very curious, and I'm sure you were curious during your research phase prior to surgery about Elixir. How does it feel?
It's actually really relaxing. You almost fell asleep today. So it's relaxing. I think the blue light beforehand was a little bit more warm. This was a little bit warm and refreshing, and you just relax. I like it so far.
So this is something, just because I'm sure people are curious about these are quilting sutures, and I'll pull all those out in a couple of days, but they're basically reducing bruising and swelling and fixating her brow. So I know that people are going, what the hell is that? So that's what that is. All right. So cool. We're going to follow up with her in a couple of days. She's going to be back to get another Elixir treatment. Drains will come out, and then we'll kind of sequentially follow her out as we take sutures out and watch her progress. All right, everyone, Cherica here. We've seen several videos of her as we've kind of followed her facial transformation journey along. And today marks our 2 weeks after surgery. So prior to us recording this right here, I've had a chance to talk to her. She's told me a little bit about her journey in terms of getting back to work, when you went to work, all these kinds of various things. So share with the team.
So I went back remotely about, I think it was like 4 days post-op, and then back in the office at the 1 week, 7 days. I feel like I probably should have waited maybe another week, but physically I was fine. I just felt like I had a little bit more swelling, so it was a little bit more noticeable that maybe something was done, but a lot of the swelling has since come down. I still have some, but back to everything as usual now.
So I saw her last week as well. She was kind of still in the process of getting her Elixir MD treatments, right?
Right.
So as I saw her, there literally has been an exponential decrease in swelling. So when I saw her last week, I mean, she looked good. She was walking and doing everything normally, but she looked kind of square in the face. You could tell that, I would say like someone had an allergic reaction or something. She looked kind of square, and now you can really see like the definition along the jawline, definition in the neck. The neck definition was there, but I think she looked a little square right in there, and now she looks a lot more feminine and more chiseled. Right. So do you agree with that?
Yep.
Okay. Pain?
Nope, no pain.
Okay. So to all my patients out there, so one of the things, and please, Cherica, if I'm saying anything incorrect or you don't agree, I don't have a problem. Just cut me off, okay? I tell my patients you can get back to work when you feel comfortable. It literally is how comfortable you are with your appearance, okay? So I have patients kind of like her. She's like, I really don't care what everybody else thinks. This is for me, and as long as I don't have pain and all that kind of stuff, I'm going to do what I want to do. And then I have patients that are like, I don't want anybody to know that I've had anything done, which I think is kind of hard to hide to a certain extent. But so you've kind of now seen her transformation. So depending on which category you feel in. So if you are the kind of the Cherica, Team Cherica, where you're like, go do what you want to do, the world's your oyster. Okay. If you're like, no, I really want to be a lot more natural looking, you can tell that's probably at about the 2-week point. So one of the other things for you, the other next big jump that I see for you is right around the 6-week point. That's where I think a lot of the firmness and all that kind of really comes down. So you feel a lot more, I think like now there's still some degree of you feel plastic.
Yeah.
You know, I think that's the best word. And that starts to kind of come down a little bit and you get to feel more soft, plush, you know. So let's see what all we did on her. We did a brow lift, face and neck. We did fat transfer.
And chemical peel.
And a chemical peel. Okay. And you can, I'm going to kind of turn her head just a little bit here. You can really see that. I'm like, I wish there was touch TV because her skin feels really soft. Would you agree? And I'm going to put some pictures. One of the things I really noticed on her, I think that the chemical peel really does very well, is smiling pictures where you can really see when you smile, a lot of the fine lines and stuff have gone away. So I'm going to put some of those pictures out so everybody can see those. Okay. So Cherica, thus far, you have, it's kind of like you've been on this huge airline ride or airplane ride. It's kind of like a journey, right? And you now have the experience of every little point on that journey. Okay. You have the experience of the consultation process, the pre-op, op, the nervousness before surgery, and some of the exhilaration as well, the immediate moment that you get to get the wow effect when you get your dressings out. All of this put together, first I'm just going to ask you some very simple questions and then I'm going to open the floor to you and I want you to tell your own story. Number one, would you do it all again?
Absolutely.
Okay. Any regrets, hesitations, anything you've done differently?
No, I don't think so. I think at first I was maybe nervous about the local anesthesia. Everyone is. And it actually turned out perfectly fine. And then like you said, better afterwards because I didn't have to deal with all of the getting rid of the general anesthesia and everything. But no, I have no regrets.
Now, you are a working woman. You're not a type of a woman that just like, hey, I'm going to have surgery and I'm going to go camp out at home for 2 months type of thing and just chill, right? I mean, so in this process of you kind of saying, hey, I want this, how important was the factor of you being able to get back to work as soon as possible in your decision-making process?
Yeah, that was very, very important.
Okay. And what are the things that you feel as you've kind of crossed the Rubicon, things that really helped push that envelope for you?
I think, like you said, the local anesthesia, because you heal a lot faster, not as much bruising and stuff. The Elixir MD, I think, helped.
How does it feel?
It actually feels very soothing and relaxing. Yeah, I liked it. And then maybe the just the supplement, like the arnica bromelain. I think taking that helped as well.
Okay, so I'm going to open the floor to you. Okay, when we started this journey, okay, the story you told us is, you had kind of started this this whole body transformation. You went through a bunch of weight loss. You kind of got to a new place and you were very happy with that. You started this whole body transformation and you wanted this part to match the rest of your energy. And you take care of young kids, you work, you're an active person. You're not like a, sedentary type of person, right? So tell everybody what you felt, how you felt, your goals, your aspirations, or whether you achieved them.
I lost 80 pounds. So like you said, I just looked in the mirror and I was like, I want to get rid of like the excess skin and laxity, all the excess laxity that comes with weight loss and age and everything. And being that I do have some young children that I take care of, I have twin 2-year-old boys, and then a 4-year-old, as well as some older children in my household. So very busy household, and then being around other, I think, parents of those, age children of 2 or whatever. I have to have a lot of energy to keep up with them, but I felt like I looked older, I think, than a lot of the other parents because I am older, right? But I just wanted to look in the mirror and feel like I looked, more like a younger version of myself. And I think I definitely got that. And it's like every day I look in the mirror and I'm just happier and happier each day because I can see like the end outcome, the swelling keeps going down every day. And so I think it'll be even better, like you said, in 2-4 more weeks.
All right. So I have Cherica here. So Cherica is 2 months post-op after we basically did everything. Did a full facial rejuvenation on her, local anesthesia. That's kind of our standard mojo. So take it away. What do you feel?
I feel fabulous.
Fabu.
Yeah.
Hashtag Fabu.
Yeah. I guess like a month ago, was feeling pretty good, but it just only got better from there because I was still, obviously a little swollen. Got my smile back. I just feel, I guess the word rejuvenated,
A full facial rejuvenation, yeah.
So yeah, I feel like it just took at least 15 years off of me. I know some people say I look 20, 25 years younger. I don't think that much younger, but
It might be someone trying to hit on you.
maybe. I better tell my husband. Maybe it was my husband. No. But yeah, I feel great. I don't know. I don't think I could have asked for anything better.
I mean, from a surgical perspective, you've healed fantastic. I was sharing, and I'm going to share to the 7.8 billion people on Earth who are watching this. I shared this with Cherica earlier. Personally, it is the greatest honor to be able to see you guys' transformations. Because I know that from your standpoint, sitting in that chair over there, there's some anxiety and there's also a lot of excitement and there's hope and all those kinds of stuff. And for me, I get to see you guys in snapshots of time. And it's like watching your little baby grow up, right? And we looked at her original picture. And as I said, she looked kind of angry at me. And I don't know why. And today, if we look at this video right now, you haven't stopped smiling. Okay. Your hair is different. It's awesome. I mean, it's the most, never in a million years could I ever imagine that this would be my life. And it's the most amazing gift to be able to see this. And so she was sharing with me that her stepdaughter, who hasn't seen her for a while, said she looks like how she looked 16 years ago.
Yeah.
So.
Yeah. Exactly. Yeah. She said, she came in and her face was just like, whoa. And, cause I saw her, I think in October, and my surgery was in, January. So, and I didn't tell her that I was having it done. So she walks in and she was like, oh my gosh. And she said, you look so young. You look like you first did, 16 years ago when I met you. So that, of course brought a smile to my face. So, yeah.
What does your husband think?
He has, he always, of course, is my husband. So he said I was beautiful before, and before he was saying how he didn't think I needed it. But, I don't know. I feel like he's not necessarily chasing me around, but, like he just pays more attention to me maybe. And So I don't know, or maybe, and then when we're out in public, sometimes I feel like he just feels proud. He looks prouder, I guess. I don't know.
That's awesome. I've gotten, so this, I like asking this question because I like asking my patients and kind of putting them on the spot, and I get weird answers. So the answers I've gotten are, one of my patients told me her husband kisses her more. Okay. One patient told me that her husband has less golf days. That's okay. So it's really like, I find it so like, you know, when you walk into this, right? And I meet you and I go, okay, and you tell me what bothers you, and I kind of put together a plan. I'm seeing this solely from me, Cherica, plus surgery. Okay. And then at the end of this, by the end of this whole process, I've met you and your husband, and you've told me about your daughter and anything about, it's like, it's like this little web, right? And it's all, and everybody has their little story. So it's just so cool. But I'm really happy for you. And I mean, you've healed amazing. I love the smile. You haven't stopped smiling all day. And I love that. I mean, that's the biggest thank you that you can get, you know, is that smile right there. So you go rock it. I mean, you're representing. So keep stepping and representing.
Thank you very much.
Thank you.